What I usually advise doctors to do is find your why. Your why is what will push you to push through the bad feelings, the anxiety, the pain maybe. And like if you have a strong why, you will be able to push through any feeling.
It's like, yeah, I would love to live that life. And it feels like, why not? In 100 years, nobody of us will be alive. Who has the power to say how you should live your life? We all have the power and the will to create our own lives.
We're not just learning for the sake of learning. We're also learning to practice that one day on a patient and make them feel less pain, make them happier. And I just love that. It feels altruistic. And that's why I love dentistry.
After 2 burnouts in dentistry, I asked myself, what if I could turn my struggles into stepping stones for others? That's how this podcast started. We learn from each other, going from stress to success. And with more than 60% of dental professionals facing stress or burnout, this conversation has never been more important. Let's get started.
Good morning. Can you hear me?
Good morning. Yeah, I can hear you. It was just perfect. Okay.
Okay, good. How are you?
I'm fine, thank you. How are you?
Doing good, actually.
Good. That's great. That's great. I'm so looking forward to hear your story today. Because you have, let's see, it's something here. Oh, okay, there, I will take it away. So, yeah, so I'm so looking forward to hear your story and share your story because, first of all, you're Souad, you're a young woman in Tunisia. How old are you?
I'm 22.
22. And then you are Souad, the dental student in Tunisia. You're going your 3rd year. And then you're also an entrepreneur. You have started your own business by helping dentists to improve, or maybe not only dentists, like professionals to improve their LinkedIn appearance or LinkedIn brand.
So first, like I want to say, I don't label myself as an entrepreneur. I think it's such a misused word and it's overly abused. So I don't want to put myself into that category just yet because I'm just starting out. I don't call myself that. But yeah, and I help healthcare professionals with their LinkedIn branding, positioning, so that they're actually seen because I've experienced this myself and I see it in my community first. And like Tunisia, all the doctors, like I'd say only 2% are using LinkedIn, like open occasionally. And like, it's such a missed opportunity in here in Africa, but not even, like even worldwide, I do observe that like doctors aren't fully using LinkedIn as it should be. They're not showing their expertise. Like it's so much missed opportunities to collab for research, for example, for like networking opportunities or maybe speaking events. And like I'm pretty sure you've experienced that yourself. So did ever someone reach out to you using LinkedIn so that you go and you talk in their event?
I'm thinking back now. Yes, they have. Yes, they have. I'm thinking now, like where most of the, like you know, I'm on Instagram, I'm on LinkedIn, so I can't really remember where some people write to me through LinkedIn, some people write to me through Instagram, and of course, it's 2 different words. I love this. I love to express myself, for example, with the dance and reels. So I can show that on Instagram, and then on LinkedIn, I'm more professional, let's say. I'm calmer. but then it's true. But I just heard it recently that it's just like 1% that show themselves write articles or posts on LinkedIn. And I was not really aware that it's less people showing themselves on LinkedIn. So why do you think it's like that?
So, I mean, I do wonder, like, I'm not really sure about the reasons. It's just speculations at this point. But maybe people don't really think of LinkedIn as a social media platform. And I think that's a big mistake because it is social media. You are talking to people, you are networking with people, but it's just in a professional setting. And maybe like they think, oh, I'm doing this for my career. Maybe like that kind of idea. Like people don't resonate with LinkedIn to use it like for entertainment maybe. And I totally get that point. So they would go to Instagram, to Snapchat, to other YouTube, just for the entertainment part. And they forgo the knowledge part. But on LinkedIn, honestly, I'm entertained. I love it as a platform, as a social media platform. I really love the place. And I even feel safer networking with people on LinkedIn rather than using other social media platforms.
Yes, I agree. And that's where we met on LinkedIn. It was a few months ago. I don't remember how exactly it started, but yeah, probably some of us saw each other's posts and it resonated. And can you remember how it started? How we met?
So yeah,
tell me. I'm older. You have to excuse me. my memory is worse.
It's okay. So like how we met, it was 8 months ago actually.
Wow.
It was on August, and or maybe it was like late July. I was just starting out on LinkedIn. That was like I was doing a LinkedIn challenge, a 30-day LinkedIn challenge, and for my first post, she's starting to remember.
I start to remember, yeah.
And so I was doing this challenge, and I wanted to tag people that resonated with me, like since you're a dentist and I'm a dental student, I really loved your content at the time, and I decided to tag you and another dentist that inspired me on the platform, and start that challenge like, oh, so I'm starting this LinkedIn challenge. I'm tagging Christina, like she's a huge inspiration, and like follow along in my journey as I'm writing about dentistry. Because when I started out, I was only writing about dentistry. Now it's a bit different.
And I will want to say two things about that. It was such a good thing that you made that challenge, because first, you connected with people. And that is one thing that I have learned in life, that we need to connect. First of all, we are much happier when we connect with other people. And then successful people know that. So they also connect, because you never know which doors can open or what person needs your service, or you can learn from that person. And we learn from everyone we're speaking with. So that is one thing that with that challenge. And the other thing is that I think when we push each other or push ourselves to post something every day, then it's like it's like we lower the pressure. Like, I just have to do this video today. You don't have time to overthink it or wait for that perfect moment, because maybe that perfect moment will never come, especially for perfectionists like most of us dentists. Like, if we are going to wait for that perfect moment, it will maybe never be that we post that video. But when, and here I want to share something, that when I get a feeling of posting something, I really try to do it as fast as possible, because I believe that somebody needs to hear that, what I'm sharing. If I wait 2-3 hours, probably I will start to question myself. Nah, maybe I will not do that post. So I try to just do it as fast as possible when I get a strong feeling. I can really feel it in my body, like I have to tell this, I have to say this. Probably somebody needs to hear this today. Yeah. So what do you feel about that? How do you organize your social media?
First, like, I totally relate to that feeling. I had that when I started out. So first, I hated posting on social media. If you search my other social media platforms, on Facebook, on Instagram, like Instagram, I have maybe 7 posts in total. I'm not a huge fan of social media at all. And on LinkedIn, when I started, like the good thing about it is it's written. It's a platform that hugely relies on written content, and that was something I felt super inclined to. I loved writing, I loved reading, and that made it easier to post. And so when I first started, I batched my content. So I would take the weekend, like maybe block 2 hours on Sunday and 2 hours on Saturday. And I would sit, I would think, I would edit. And then I just wanted to get used to the feeling of pressing posts myself. So I didn't schedule the posts when I started, because like there's something special about hitting post. So you actually see your words materialize and be seen by other people. Now they're online. Now people can read what I wrote. And that's a scary feeling, but also is super nice, because like, oh wow, someone actually liked what I wrote, what I said, what I thought. And and like it's a feeling that you need to get used to. But it's also like, it's just starting is the hardest part. I remember sitting like maybe 10 to 5 minutes. I was, oh wow, I should edit this, I should edit that. This doesn't feel nice. This doesn't read nice. And I was, oh, should I press this? And like, it was like some kind of anxiety, apprehension. I was like, just hit post, Souad. Just hit post. And so I did. And then just let the magic happen. And even if it flops, it's okay, since you have 30 days. Every day is a new opportunity to write something new and to put an opinion out there. And the good thing is, people forget what you write about. Most people won't even remember what you said yesterday. So that's a huge help. Like, what I want to say to people is, if you're scared to start, it doesn't matter. First, even if you push it and it flops, you can delete it. Like, that's the worst case. And secondly, like, people do forget your content, even if you suck at first, and you will suck. I'm just saying it, like, you will. But even if you do, like, just get it over with, like, do the bad repetitions at first so that you get better even faster. So, yeah.
Yeah. Thank you so much for these advices. I totally agree with you. And I play with that thought as well, because inside me, and that little perfectionist is going away more and more the older I get. But it's still there, that little person. So I can be very, very self-critical, but I get the same feeling. First of all, Christina, nobody's going to notice that detail. You know, it could be a small detail about myself that disturbs me. And I'm like, no, probably nobody will see it. And if they see it, in 3 seconds, they have forgotten about it because they're already scrolling and looking at something else. So we are overthinking. We are taking ourselves too seriously. People don't care. People forget you. That's the cruel reality. But that's also a feeling of freedom, because then you can express yourself and throw it into just like you said, let the magic happen. let's see who it resonates with. And it's magical. So what made you, can you remember the feeling like when you started to post? What was the feeling you had when you started to do the first post on LinkedIn or that challenge? Or
So what I want to say is, so to give a bit of context and backstory to why I started LinkedIn on the first place. So I just failed dental school, and I was feeling down. I was feeling depressed, like, you know, that feeling of failure, and it was a hard time for me. And I needed some kind of distraction. I needed some kind of outlet. And that's when someone very special to me suggested I start on LinkedIn. And so I did. I first started with a course called Lemnis Branding School. And from then, I decided to hop on the 30-day LinkedIn challenge, which I did. And those were the feelings I started with. So my reasoning behind this is like, let me just write my heart out. And even if no one resonates, at least I've done something that mattered to me, which was writing. And so it was just, okay, I feel that's okay. I'm trying to get over that. Let me just do something that distracts me. And so I posted every day for 30 days. And by the way, it didn't stop there. I then posted for 90, and now like I'm on my 8th month of writing constantly on LinkedIn. So that's the mindset I was introduced to on LinkedIn, and that's why I started. That was my why. And what I usually advise doctors to do is find your why. Like, why do you want to build your personal brand? Why LinkedIn specifically? And what do you want to achieve? So all those questions will let you first get over that fear of posting the first time, the second time, the third time. Your why is what will push you to push through the bad feelings, the anxiety, the pain maybe. And like, if you have a strong why, you will be able to push through any feeling. And so.
So you are a dental student. How do you see your future? Do you see that you will combine dentistry with writing? Because it looks like you're very passionate about the writing.
Yes, so I did consider that. I discovered that I loved the research part so much, like even more than practicing on patients. I think I'm more passionate on like reading more about dentistry, reading more about the human body, researching, and just putting that into words and finding solutions to some kind of problem. And when I think back, that was the reason why I started, like I wanted to become a doctor in the first place. It started from the love of science and the love of research and learning. And the past years in dental school, it reinforced that idea, like the pressure that when you confront a patient, like you need to be super careful, you need to be like you there is no room for mistakes. And that kind of pressure, like it's not easy to get over with. And I don't like that feeling, to be honest. Like, and what I found for me, what works is, I love research. There's not that kind of pressure, like confronting a patient, taking care of them. Maybe they're complaining, maybe like they've had a bad day, or I did have a bad day. So as a dentist, you need to be really informed of and super in control of the environment, your assistant, this and that. And like, I don't know if I want to do that, but I do know I want to write about that and dentistry. And
I'm so happy. I get really even emotional. Well, I'm a very emotional person. Oh God. I get very happy to hear. Sorry.
It's okay. It's okay.
It's happy tears, huh?
Oh my.
I get very happy to hear that you know what you want, you know? Yeah, I'm back. Yeah,
Welcome
sorry
back.
for that. Yeah, thank you. Yeah,
You're
so
welcome.
what
Sorry
I
for
wanted to
making you
say is
cry.
no. It's happy tears because you know I think that I had the same feeling as you have had, but I was not aware of it. You know, I was this perfectionist, this student, and everything was worrying me so much because like you said, it's not so much room for mistakes. And I could never handle a mistake. Like it had to be perfect. Everybody had to be happy with the result. I had to be happy. And if it was something that was not really 100%, then I would not sleep at night. It would be, and that is how it was during all these 18 years as a dentist. So it was something with my personality, but I was not aware of it. So that made me so happy to hear such a young woman feeling like and knowing that I don't feel good in that situation, feeling that, but I feel better writing, for example. So it makes me so happy. And I think that your generation are much more aware of these things, of your feelings, of different options. What do you think?
Oh, so you're opening debates for Gen Z and what we and what they tell us is Gen Zers are too emotional. Don't they say that in the media? Like seriously.
I don't know. I have not heard that exactly. That you're too emotional. They say that?
Yes, so first they say, oh, Gen Z, they're not like suitable for the workspace. They don't have work ethic and they're super emotional. And what I do translate that as a Gen Z, it means that we are super aware of our emotional needs. Yeah, that's first. And second, that we're also super aware of our physical needs. So if the workspace is toxic or if the hours are too long, we call that out. We're not the type of people, we're not like millennials that would like just shut up and do the work. We don't do that. If a place doesn't suit us, we will try to either find a solution or just exit the place. And I feel like that's a power. That's not something to be ashamed of. And like, unfortunately in the media, they portray Gen Z as like, as I told you, emotional and not suitable for the workspace. But like, I think it's totally wrong. Like, as a generation, we've lived our whole life surrounded with technology, like now with AI, like we've had in the internet since we were toddlers, and that made us super curious from such a young age. And we would like look for information, we would learn new stuff. Like, I think it's totally wrong to say that Gen Z aren't like suited for the workplace.
No.
So yeah,
I agree totally. I agree. My youngest daughter, she will be 17, and every day we're looking at one episode. It's a Spanish YouTuber. He's traveling 80 days around the world. His name is Plex. And like yesterday, he was in Hong Kong, I think, and today he will be in Vietnam. So you can follow his trip every day. And my daughter's like, I want to travel too. And I love traveling as well. So I was like, yeah, I would love to live that life. And it feels like, why not? In 100 years, nobody of us will be alive. Who has the power to say how you should live your life? We all have the power and the will to create our own lives and try to achieve it. So it's so wrong to just say that this is the way it should be. You should be working Monday to Friday from 7 to 5, and that's the way it will be. And I think that if society, if the world won't change that, Gen Z probably, like you said, I know young dentists who are exiting dentistry, for example, because they cannot, or they work less days because they cannot accept it. So I think that the society has to start to change and make it more flexible, not having the same hours for everyone, because you're removing the feeling of power, the feeling of having an option to choose. And that is a horrible feeling, year after year after year after year.
Exactly. Like, we're the type of generation that we don't believe in constraints and we don't believe in rules. I'm not saying this in a bad way, like, but like, well, just like you said, we're more flexible and we are more willing to explore new things and like change the way of things. And and I do feel like dentistry is also starting to shape in that way. Like, just like you said, people are starting to choose to work less, maybe fewer days or fewer hours. And like, I think that's definitely something I might consider in the future, maybe a hybrid style of like maybe practicing 2 days a week and like the rest is for my LinkedIn business, for example. That's something I'm definitely considering.
Yeah. And I agree totally. And that's one of the things that I speak a lot about in social media, because I'm a living proof that it's not sustainable to just work hard. I worked hard for so many years until I came to the point that I didn't want to hear about dentistry. I didn't want to see a dentist. I didn't want to see a dentist in my feed. I didn't want to hear anything about teeth. And it's such a... And now it's not that. But when I was at my last burnout, that was the feeling I got. So is that okay? Is that correct? I mean, it was my own fault. So I'm not blaming anyone, but I'm saying it's not the way to push yourself too hard, because you could come to that point that you don't want it at all. And do we want our dental students or our future dentists to feel like that? No. Then it's better to adapt to that person. So how many days feels good for you? Is it 3? Is it 4? Is it 5? We are all different. Or is it one day with that, another day with science? You can create your world, your life, how you want.
Exactly. And like, the good thing about, like, I saw like 1 or 2 months ago, there was this research talking about dentists are opting out of owning their own practices. So we're joint group practices are on the rise, and this made me think, like, the newer generation doesn't want to really own their own practices. They're opting to collab, to do group practices. And like, why is that in the first place? And maybe, just like you said, one of the reasons might be they want to work less in the same place, let's say. Because like, as a dentist, we don't have the freedom to move here, move there, work from different countries. Unfortunately, we're tied to that place, to that practice. And maybe that's why people are choosing to do the joint group practices, so that they can have more freedom, also shared responsibility. So it's way easier to manage something when it's in a group. And maybe those are some reasons why people are choosing to do group practices. What do you think?
Yeah, I agree. I have not heard of that, but it sounds like a good thing. And I remember when I was a volunteer in 2019 for Dentistas Sin Fronteras, Dentists Without Borders. We were in Senegal. We worked really hard for 2 weeks, but I felt so strengthened. I felt so filled with good energy. Of course, first of all, being a volunteer is really special. It's a very special feeling. If somebody's listening to this, I really recommend you to go to a volunteer project, because it's incredible. It's such a beautiful feeling and experience. But also another thing was that we were working in the same room. So we were about 20 dentists, or no, not so many, 13 maybe, in the same room with all the patients. So you never felt alone. And if you were struggling with an extraction or something, you just said, could you help me, or could we swap? So could you continue with this patient? So you felt like you were part of something. And that was a feeling that, wow, I have missed that. Because when we are in dental school, we have that community feeling. But then when we start in our own practice, you have not come to that point yet. But when you start in your own practice, it's you and the patient, and you have all the responsibility. Something goes wrong, it's your fault. So it's very, you enter a bubble. And especially if it's a small practice, it's you and your assistant, or you and your hygienist. And that is something that I realized there that I was missing, to be part of a bigger community. So I can imagine that maybe if you're a clinic with many dentists and collaborators, then you will get that feeling. So yeah. What do you feel has been the most challenging and the most rewarding part of dental school until now?
Oh, that's a really good question. So, for the challenging part, let's start with the rewarding part first. Let's start with the positives.
Yeah.
So first, what is really rewarding being in dental school is, obviously, that's the career you chose for yourself. You get to jump in that career path. And there's so much variety in the dental school, like many subjects, many specialties, and I love that. I love variety. I love that I get to learn about so many things about the human, and also we get to jump in every specialty and learn more. It's just something I really love. Just learning more is something I absolutely love, and especially when it's towards helping other people. So we're not just learning for the sake of learning, we're also learning to practice that one day on a patient and make them feel less pain, make them happier. And I just love that. It feels altruistic. And that's why I love dentistry. And also, just like you said, there's this sense of community. Since we always work in groups, and in the labs, we have fun. You get to see your friends' work, other people's work, and compare. And we also help each other, and that's something we don't typically see in other. Maybe I don't know about med school, but in dentistry we have this sense of community like no other, since our labs are always in groups. So that's something I really love about dentistry as well. About the challenges, obviously is exhausting. Is so you have to learn so many materials. You have to rely on my memorization as well, which isn't really my forte. And also sometimes you feel like you suck. So especially when you try something for the first time, And we have this system in Tunisia, like every session you need to get a mark, a grade, even if it's something new. It's like a new dental preparation. Each session we have this grade that we get, and the grading part is what oh no, I'm not really satisfied with my work, but I still have to get a grade, and this grade maybe or may not be part of the final grading, which adds a layer of stress. And that's a part of dentistry I really don't like. And also, like, it's all the things about dentistry that I don't like are typically like, it's because of the system, not because of dentistry in itself, but because of how the system is made for us to become dentists. So let's say the long hours, like we study so much. Sometimes you'd have a 6 or 8 hour study day. That's so much for a student. And like, especially if that's many days in a week like that, you will be exhausted. You don't have time to do things that you really love other than studying. You don't have time to regenerate. And like the weekend, you need to revise the old material, the material of the past week. And it's like just a rabbit hole of you trying to keep up with the studying, you trying to get the best grades. Yes, and also like one thing is sometimes you'd have professors maybe like comparing us. Oh, X had the best preparation, or did the best in this. And that also hits your self-esteem as a dentist. Those are the things I don't really love about dentistry. So yeah.
Yeah, I agree. So what are your hours in, how long days do you have in school?
So we have typically 5 days. And the hours is like, we have our labs in the evening, and we have the in future courses in the morning. So those are 4 hours, and the afternoon it's like 2 hours and a half, sometimes 3 hours. It's a lot.
So it's from from 8 to 5. I remember, we were 8 in the morning to 5 in the evening, and maybe we had theory in the morning and we had patients in the evening, and
It was for us is from 8 to 4, and like we go back at 1 p.m. So it's like you don't have the 2-hour rest in the middle. But anyways, I feel like it's a lot personally.
Yeah, it is a lot. And it feels like, if I remember, I go back, the first year was calm, like, oh, we have a seminary there, a webinar there. It was like a honeymoon, like, wow, this is... And then when the second year came, like, boom, and a third, a fourth, and fifth, and more practical. First, it started with a little bit of theory, and then it became with the practical things as well, tasks. But do you feel that there are subjects they could remove from dental school, like that maybe they enter too detailed?
Yes, definitely. And for example, for our system in particular, we go too deep in the semiology, the pathology, the pharmacology especially. We have the same program of pharmacology as our as the pharmacy. The curriculum of
students.
Of pharmacy. The curriculum of pharmacy students in pharmacology is the same for us, for dental students in the 3rd year. And the reason why is like dental school is near pharmacy school in Tunisia. They're literally next to each other. And so for pharmacology, we do have their professors, and that's why we have so many. All the subjects they do study in pharmacology, we do as well. I think it's too much. Like there are other subjects like in semiology. We also have the professors of the med school of our region. So it's like a complex of so many universities next to each other, and that's why we get to like experience that subject and those lessons. Like they are taught by a specialist in that field, and while that is something good, it's also like too much for us because like we have our own specialties, and I'd rather I master those first than like study a lots of different things and I go too deep in each one. It's too much.
Yeah. Are there things that you feel that they are not including? Like, have they taught you or taught you? You say maybe grammatically. Have they taught you like stress management, time management, communication skills, problem solving? Have they taught you those things?
I want to just reverse the question. Did they teach you those? They did?
If we had it.
Did you, like when you were in dental school, did they teach you those? No. How long ago were you in dental school?
It was from 2000 to 2005, so 20 years ago, 25 years ago.
Okay, so 25 years ago, like after 25 years, and we still don't have those subjects in dental school. They still don't teach us time management. They don't teach us stress management. They don't teach us how we can be like, even like, think about it. We also need some marketing skills, some finance skills, like how to manage our clinic, how to maybe hire our assistants. Like all of that is also part of owning a dental practice, because even your dental clinic, it's considered your business as a doctor. You should look at it in a way like you're also an entrepreneur in a way. You have people that you pay, you have like materials that you need to keep track of a lot of things. And all of those you need to figure out on your own once you finish dental school. And many people do struggle with that.
Oh, yeah. That is something that I'm surprised, or of course, no, I'm not surprised because I know you're much more open-minded, but I never thought about these things during my 5 years because nobody was speaking about it. It's like what you don't speak about doesn't exist. So when you come out in the real world, it depends of what you have from your home, what you have seen. Maybe if you have parents who are business people, maybe you have the mindset of financial. But if you don't have that, it's so difficult even to charge. Like there are so many situations where I felt, what should I charge in this situation? I just told them the diagnosis. I just did that. Yeah, but you have been studying for 5 years to know, what they have. It's not like, so you don't, the risk is that you don't value yourself and nobody has taught you how to value yourself. So it's that is causing a lot of stress. I had a podcast the other day with Andy Acton from UK, and he said something that stuck with me, like you feel stressed when you have to solve a problem that you don't control, that you don't know how to manage, and all those things are things that we don't know about. We don't have the financial skills, and even if we work for somebody, it's about money when you start. Of course they will want you to consider how much revenue you bring into the clinic. So it's that, and like you said, how to hire, how to communicate, how to solve a conflict, how to discuss something, because you have a lot of drama at the clinic. You have a lot of people who are working very close to each other during many hours in stressful situations. You have to know how to solve these things. So why do you think that after 25 years, we still don't speak about these things in dental school?
I hope my answer won't be controversial. But for me, the reason why, because the people that managed dental school 25 years ago are still the ones managing dental schools right now. Because, so of course they have the experience, they have the knowledge, and I totally understand why they are in such positions. But the fact of the matter is, if it's the same person, the same systems, the same minds that are still in charge for the past 25 years, of course things won't change. And I feel like as doctors in general, especially older doctors, they're not as easy to be persuaded, and they you are young, Christina. When I talk to you, you understand me, you get new ideas, and you try to understand. But if you talk to maybe a 60-year-old, he won't he will say, I have the experience. I've done this for over 40 years. Who are you to say, that we need this and this and this and this? But I am the students. I am going through the system right now. You need to listen to me. I'm living this right now. And so this is why we don't see as much change as the younger generation wants. And I hope one day this changes. I'm pretty sure, I don't know how it goes elsewhere or in other places in the world. But in North Africa, this is what is happening. We're sticking to the old systems, the old ways. We're not super easy to be to try new things and implement new systems of education.
I agree, and it's that I think that happens everywhere, because I will share a secret here in front of everyone. When I had my burnout 2022, I just one day got this feeling I will write to different universities and ask them, what are they doing nowadays to prevent burnout from happening? Because I started to research. I was is this only happening to me? And then when I found all these studies that it's a normal thing that happens, then I wrote to 12 different universities to ask them, what are you doing nowadays to prevent burnout from happening in dental school? And at one university, I emailed several persons, 7 different persons. Mm-hmm. And the highest, the director of the university, she answered them, and she didn't realize that I would see the email too. So she said, I don't want anyone to answer her. We don't know who she is. But I was presenting myself. I said my name, on social media, you can see, where I am, everything. And I was we don't know, and we are not going to answer her. So they were just closing the door, excluding, nobody was even entering the subject. And that made me, I got so many different feelings, but and sad. That this is going on, but you're just quiet.
Choosing to ignore it. Yeah.
And that is so horrible because there are so many people suffering, and you can solve it by just teaching the students about these things. It's not rocket science. It's just some basic things about communication, about how to take care of yourself and the financial part, and you could solve a lot of problems. So, but how do you manage time? Because you are a dental student, you have created an app about how to study and time management, and you're also helping healthcare professionals. So how do you handle time?
So that's a good question. Since like I'm repeating the year and right now I have more time in my hand to experiment, to build the business, to try all those things. So that's like one major point about why I was able to do all those things. But also, like even before like me repeating my year, I was an athlete. I was a volleyball player, and I'd go to practice like maybe 5 times a week. And I would study, we would go to practice, like take care of my home. Like I even before repeating the year, I had this ability to manage my time. And what I would say to my fellow dental students is like, you need to learn more about yourself and the way you study. So, and like your energy levels, you need to also know if you're a night owl or you're an early bird, like all those things, all those elements, like are you able to study after a meal or not? Like all those different things, you need to sit with yourself, take note, try things, like try to study in the morning, try to study in the afternoon, and like iterate and try until you find the system that works for you. For myself, I really suck at memorization. So I had to learn the hard way that starting way before, like trying to learn from like 2 months before the exam wouldn't work for me, because like I had the memory of a goldfish. I can't memorize things from heart. So what I would do is I would read the material, do my summaries, like craft my maybe Enki if you're a fan of the Enki cards, and like have them beforehand. You don't have to memorize those same things 2 months in advance. You just need to be to maintain some kind of, okay, I check my courses every week, let's say, and you should like maintain a minimal base of studying. So like the goal is that you don't burn out, and the goal is like to work smart. So I would like study maybe 1 hour to 2 hours per day. And you would maybe ask me, how do you find the time, since our schedule is super packed? What I would do is the amphitheater lessons that I deem like not super fit for me. Maybe I don't understand the professor very well, or maybe like I feel like it's not a course that I want to attend, that I'm able to understand on my own. I wouldn't attend that, and instead like take the time to learn the material myself. If that's your learning style, if you're able to do that and you love learning on your own, you should definitely do that. Especially if like you're like me, the amphitheater it feels like a distraction. The professor is talking too slow. There's noise, there's people, like maybe it's not your environment, and maybe you're like me, you want to stay in your bubble, you want like to read, to search, ask ChatGPT, and like whatever works for you is what you should go by. Like basically trust your intuition, iterate, try different things. Like I nap every day. I can't go a day without napping. And that nap is what makes me energized after that to study better, because I feel like more focused, and like all those things are super important. It's not important that you do many study hours. It's better to make less, but they need to be of high quality. So that's what I advise other dental students.
And that's what this podcast is about. It's called Going from Stress to Success. So that's a great point and insight to take away from today's podcast. And it all starts with ourselves, isn't it? It doesn't matter what we speak about. It all starts with knowing yourself. So I want to thank you so much. And I want to know, and I took a decision that we will do another podcast because we have more things to speak about. You told me about a health issue that you had also. So we have much more to speak about in our second podcast. But where can people find you and what can you help them with?
Okay. So where can people find me? Obviously on LinkedIn. I'm like Souad Menif, follow me. And what I write about is how healthcare professionals can put themselves out there, start personal branding, and like showcase themselves. Because as medicals, we're not trained to show our skills outwardly. They always tell us to like help patients and move on. We are silent workers, and I feel like we're not celebrated as we should, because we've worked too hard for this. We've spent so much time on our craft, learning, studying. It took sweat and tears, and literal tears. I'm not just saying it. We would cry revising. And I feel like what we do as medical professionals should be celebrated, and we should speak in social media and like spread the right information. Why would a fake health guru like talk about health issues and ask the real professionals like we are quiet about it? I want to change that. So people, please, doctors, follow me. And like, I would really love to see you like start tomorrow, like start with a 30-day LinkedIn challenge maybe, and share everything like every day about a medical issue you see each day, like your feelings, your roads. We want to read more about doctors, please. Thank you so much, Christina, for having me.
Thank you. Thank you so much. And we will, me too, laughing, crying, everything. You never know what will happen when we speak. So, we will meet again. We will have a second podcast because, Souad have many more things to tell us that we need to know. Thank you so much.
Thank you.
I wish you the best. Thank you. Speak to you soon again.
Yes. Thank you. Thank you. Thank you. Thank you.
Bye-bye.
Bye-bye.
Souad.
Thank you so much.
Bye-bye.
Tell me. Bye-bye. Thank you.
Stay at, have it open until it's uploaded totally, because I can see, it depends of the internet. I can see that you have 12% uploaded.
Yes, I can see that.
Yeah. As well. So just keep that page, open until it's 100% uploaded, and then you can close it. Okay.
Okay. Do you think I can change internet connections in between, or that would like stop the upload?
Yes. No, it's okay. It will reload again.
Okay.
Thank you so much, Souad. And sorry for crying.
No, I'm sorry.
I'm so happy for you. I'm so happy that you have realized things that I was not even aware of. You know, I was like in a bubble, just following what I thought I should do. And yeah, but it's so important to listen to yourself. What do I want? What do I enjoy? So thank you. We
Thank
speak
you
to
so
you
much.
soon, Souad. Okay?
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye-bye.
Thank you.
Thank you. Thank you so much. Thank you.
I wish I had a smiler when I had my dental practice. It removes so much stress from the dental team, handling online bookings, patient questions with a chatbot, pre- and post-treatment automations, and even offering a marketplace for dental treatments. Smiler isn't just a sponsor, it's a solution. That's why I love working with them, because they take dental teams from stress to success. If this episode helped you, don't keep it to yourself. Like, comment, and subscribe. Not for the algorithm, but to help more dental professionals go from stress to success. Your support means the world. See you next time.